When it comes to the word muscle, most men immediately think of the arms, legs, or chest, parts we can flex and see clearly in the mirror. But in reality, your body contains a silent group of muscles that cannot be controlled by willpower, yet they directly affect your ability to have erections and sustain male vitality, especially after the age of 50. That is the smooth muscle, the type of muscle found in the intestinal wall, the blood vessels, and especially in the internal structure of the penis itself. Interestingly, although the penis contains a large amount of muscle, these muscles don't function like any other group you've ever trained in the gym. Today, Dr. Marie, will take you on a journey to explore a little-known truth about how smooth muscle in the penis works, and why misunderstandings about it may be quietly robbing many men of their performance without them even knowing. And don't take your eyes off the screen, because the very first part coming up will reveal a biological mechanism that most men misunderstand. And that very misunderstanding could be directly affecting your sexual health every single day. But before we begin, I'd really love to get to know you a little. Where are you watching this video from? Please leave a comment below. I'd be so happy to know who I'm walking alongside on today's journey. And if this is your first time visiting the channel, don't forget to hit subscribe and turn on the notification bell so you won't miss out on accurate, easy-to-apply insights about men's health after midlife. Now, let's move into the first section, where you'll discover a truth you probably have never heard anyone explain this clearly before. Part 1. Decode the structure of smooth muscle in the penis, the foundation of male sexual function. When we think about muscles, most men instantly picture familiar muscle groups like the biceps, chest, or abs, the kind that show up in the mirror when you suck in your stomach or lift weights. But the truth is, our bodies contain 3 completely different types of muscles, and not all of them can be trained the way you think. According to medicine, the 3 main types of muscle include skeletal muscle, also called striated muscle, the kind of muscle you can control voluntarily, used in everyday movements like walking or lifting things. Cardiac muscle, found only in the heart, responsible for pumping blood constantly and without pause. Smooth muscle, the least mentioned type but present everywhere in the digestive tract, the vascular system, and especially in the corpora cavernosa and spongy tissues inside the penis. The difference between smooth muscle and the other 2 types is this. It is not under conscious control and functions automatically via signals from the autonomic nervous system. You cannot command smooth muscle to contract or relax like you do with your arm or leg muscles. Let's look at a clear example. When you want to lift a heavy object, your arm muscle contracts, a controlled, deliberate action. But in the case of the penis, the opposite happens. When the smooth muscle relaxes, blood can flow into the corpora cavernosa, triggering a natural erection, like a hydraulic system, precise and intricate, already programmed by nature. This fundamental difference is what causes many men to mistakenly believe they can train the penis like any other muscle. A common, but dangerously false belief that we'll explore further in the next section. Even more fascinating, because the penis is mainly composed of smooth muscle, it has an automatic training mechanism that happens during sleep, and you may have never noticed it before. Sounds strange, but this is actually a special biological function that nature has designed exclusively for men. So when does this mysterious process occur? How does it work? And what role does it play in your sexual health? We'll uncover all of that in the next section. My friend, if you're still watching this video up to this point, I truly appreciate that you're taking your health seriously. Please leave the number 1 in the comment section below, so I know you're still right here with me on this journey. Part 2, Nocturnal Erections, how the body trains itself to preserve male vitality. Normally, we assume that when the body is resting, all muscle groups also completely relax. However, for the smooth muscle inside the penis, the mechanism is entirely different. In an unstimulated state, this muscle group actually stays continuously contracted, causing blood flow to the area to remain at a minimal level. And this is where many people are surprised. While skeletal muscles need to contract to function, the smooth muscle in the penis must relax in order to perform its most important function, allowing blood to flow into the corpora cavernosa and create an erection. If the contraction persists for too long, blood supply becomes insufficient, leading to a lack of oxygen and nutrients in the smooth muscle cells. Over time, this results in declining function and reduced sensitivity in the genital area. However, the body has developed an automatic mechanism to prevent this, a biological process that silently takes place during the night. Specifically, during REM sleep stages, the phases where dreaming occurs, the nervous system sends signals that help smooth muscles relax, allowing blood to rush into the penis and generate natural erections, not arising from sexual desire or external stimulation. In a healthy man, this phenomenon can occur 3 to 5 times a night, with each instance lasting several minutes. This isn't just some random physiological phenomenon. In fact, it's a self-maintenance process that the body has built in to ensure smooth muscle tissues remain well-nourished, resist degeneration, and maintain flexibility of the blood vessels in the genital region. In other words, every night, your body is silently organizing a workout session for your penis. And the prerequisite for this training to happen completely is a deep, uninterrupted sleep. But if, for any reason, your sleep becomes shortened or frequently interrupted, will these silent training sessions disappear? And if they do, will sexual function be affected? Those questions will be answered in the next part, where we'll take a closer look at the modern-day factors that are quietly weakening your sleep and directly affecting men's health. Part 3. Hidden factors that disrupt sleep and deprive the penis of its natural training. Today, the quality of our sleep is being seriously compromised by modern lifestyles. And this doesn't just leave you tired during the day. It also accidentally disrupts the nighttime training cycles of smooth muscle in the penis that I mentioned earlier. In the past, when the sun disappeared, people would go to bed. No phones, no TVs, no artificial light to deceive the brain. But nowadays, we live in an environment of constant illumination, especially blue light emitted from phone screens, tablets, and televisions. This particular type of light inhibits the production of melatonin, the key hormone that helps the body enter deep sleep. Aside from light, many modern habits are also pushing the body into a state of chronic stress, which damages its ability to relax and recover. Staying up late and irregular daily routines, overuse of alcohol, caffeine, or smoking, chronic conditions like hypertension, diabetes, or obesity, all of which reduce blood circulation and lower the likelihood of natural nighttime erections. As a result, when sleep is disrupted or lacks sufficient deep phases, especially REM sleep, the number of natural nighttime erections decreases significantly. And if this continues long-term, smooth muscle cells gradually lose flexibility, sensitivity, and may even experience irreversible functional decline unless changes are made in time. Additionally, age is an unavoidable factor. After age 50-60, tissue recovery slows down, sex hormones are produced less, and the biological clock becomes more easily disturbed. Ironically, the older we get, the more the body needs deep sleep, but the harder it becomes to achieve. Put simply, you cannot use willpower to train your penis, but you can absolutely create the right conditions for the recovery process to happen naturally, through timely sleep, a balanced lifestyle, and effective stress control. However, what's worth noting is that many habits widely believed to be good for sexual health are, in reality, making things worse. In the next part, I'll help you clearly identify these common misconceptions so you can avoid the same costly mistakes that many men over 50 are quietly making. If you're still watching the video up to this point, thank you for staying with me until now. I truly appreciate it. Please leave the number 3 in the comments below to let me know I'm not speaking alone. Part 4. A scientific lifestyle. The natural physiological workout most people overlook. The truth is, you don't need to go to the gym, use modern equipment, or invest in costly therapies to support your sexual function. For men over 50, a healthy, balanced lifestyle with a stable biological rhythm is already powerful enough to bring about sustainable improvement. Many people think that simply taking supplements, eating better, or using quick tricks to boost performance is enough. But if your body's internal foundation is out of sync, especially sleep, hormones, and blood circulation, then external aids can rarely deliver the desired effect. A well-regulated lifestyle doesn't just mean eating on time or going to bed at the right hour. It also includes maintaining a stable circadian rhythm, creating the ideal conditions for your internal systems, like endocrine, nervous, and circulatory, to function harmoniously. Imagine this. If you go to bed late every night, constantly use your phone before sleeping, eat late at night, and frequently consume alcohol, then even if you take expensive supplements or try testosterone-boosting exercises, your sexual performance can still easily stall. Men entering middle age must understand this. The body does not respond well to sudden or extreme changes. What truly helps is consistency, from the smallest things like drinking enough water, doing light movements, or breathing deeply to relax before sleep. These seemingly simple actions, if done daily, can have a significant effect in supporting sexual function and improving emotional quality. Don't chase recovery through complicated methods. Sometimes the small, proper, and repeated habits are the most precious therapy your body needs. However, besides lifestyle, there is still a blind spot that many men are making mistakes in, and that is pelvic floor exercises. Many believe these are effective for improving sexual function, but the reality isn't that simple. In the next part, I'll help you clarify this to avoid falling into the same trap that many others have already encountered. Part 5. The pelvic floor. Don't train it until you truly understand it. One of the most common questions from men is, do pelvic floor exercises improve erections? The answer is, possibly yes, but they can also backfire if you don't fully understand this muscle group and the actual condition of your own body. The pelvic floor muscles, also known as the perineal muscles, play a very important role in controlling urination, supporting the bladder, and regulating part of the sexual function. When this muscle is weak, you might have trouble holding urine or feel unstable during erections. However, what most people don't know is, if this muscle group is overactive or constantly tense, it can actually block blood flow to the penis, leading to reduced erectile ability or even loss of sensation. In fact, during my work with patients, I've noticed that most men don't actually have weakness in this area, but rather increased muscle tone, meaning the pelvic floor is constantly tense due to habitual clenching, chronic stress, or overuse of sexual exercises without understanding the mechanism. If you continue to contract this muscle group when it's already overly tense, you risk pelvic pain or ejaculation disorders. And this is a very real possibility. Another common problem is that many people don't know where the pelvic floor actually is, and they can't feel it when trying to activate it. One study found that around 25% of men are unable to voluntarily activate this muscle group, simply because they've never learned to connect their awareness with the deeply located muscle. Many even confuse the name, calling it the sink muscle or toilet floor muscle, which only makes the concept more vague and difficult to grasp. That's why in practice, I almost never encourage men to train this muscle group, unless they've recently had prostate surgery, suffer from severe urinary issues, or have a clear medical indication. Instead, I guide them to learn how to relax, breathe deeply, and develop more refined body awareness. Because sometimes, true recovery comes from proper relaxation. If you're wondering, so how can I correctly identify the pelvic floor and learn to control it in a scientific way? Then that's exactly what I'll be sharing in the final part. You'll be guided clearly, in an easy-to-practice manner, and most importantly, you'll no longer feel confused or do it incorrectly like before. Don't miss this part, because it is the foundational step that will help you confidently care for your sexual health in a natural and sustainable way. Part 6. Identifying the right pelvic floor muscle. The secret to sexual recovery begins with subtle awareness. The pelvic floor is a group of muscles located deep in the lowest part of the pelvis, stretching from the pubic bone in the front to the tailbone in the back. It functions like a base layer that supports the lower abdominal organs, while also playing a vital role in controlling urination, bowel movements, and assisting erectile mechanisms. Unlike surface muscle groups like your arms or legs, which you can easily contract and feel, the pelvic floor is often hidden beneath stronger surrounding muscles, making it harder for many people to identify. One simple way to feel the pelvic floor is to mimic the sensation of trying to stop the flow of urine midstream. When you gently squeeze in that area, without tightening your abs or clenching your buttocks, the muscle you feel is your pelvic floor. Some people may also try to imagine gently pulling the anus inward without using the whole body's strength. However, identifying the pelvic floor is just the first step. What's more important is learning how to control it properly. Because as I mentioned earlier, many men don't have a weak pelvic floor, but rather an overly tense and overactive one, which restricts blood flow and reduces sexual reflexes. In such cases, you should not keep clenching. Instead, focus on relaxing, breathing deeply, and allowing the lower abdomen to stay naturally soft. Methods like diaphragmatic breathing, meditation before bed, or soaking your feet in warm water are indirect ways to help the pelvic floor relax and return to balance. If you've heard that Kegel exercises can improve sexual function, that's only true if the pelvic floor is truly weak, such as after prostate surgery or in cases of urinary disorders. But for most middle-aged men, just remember one thing: don't clench, learn to relax properly. Taking care of this muscle group isn't about training hard or forcing it. It's about your ability to listen to your body, regulate from within, gently but effectively. My friend, at this point, I believe you've realized something important. Sustainable sexual health doesn't come from tricks or special products, but from understanding, and from how you treat your body every single day. The penis doesn't need complicated exercises. It needs deep sleep, a stable nervous system, a body that's not constantly forced. And more than anything, it needs a man who knows when to take action and when to let go. The fact that you've followed this video all the way here, with seriousness and a willingness to learn, is already proof of the respect you have for your own body. And I deeply appreciate that. If today you can simply start by turning off your phone 30 minutes before bed, breathing deeply to relax your lower abdomen, and stop forcing yourself to follow outdated methods, then you've already taken the right step forward. A man's strength doesn't fade with age. It's simply waiting for you to awaken it through knowledge, patience, and a renewed attitude toward life. If you found today's sharing valuable, please subscribe to the channel and turn on notifications so Dr. Marie can continue to walk with you in the next chapters of your journey, wishing you good health, peace, and confidence every day. Thank you so much for listening.